Throughout my life, I've had many family members, close friends, and patients struggle with addiction. Whether it may have been from the abuse of prescription drugs, alcohol, heroin, meth, marijuana, tobacco, or cocaine, the struggle is real. I have seen some enter different rehab facilities, coming out clean or relapsing, and unfortunately some still remaining addicted to their drug of choice. Through my experiences with those that have addiction, I've come to realize that addiction affects us all in one form or another. So if addiction affects us all, then why is there such a huge stigma of addiction? Stigma is defined as a complex of ideas, attitudes, feelings, and behaviors, a negative word or description of a person that marks that person as different from normal people. This difference is viewed as undesirable and shameful, often causing negative attitudes and responses, prejudice, and discrimination towards that person. With that being said, today I'd like to take some time to talk to you about stigma. Stigma of addiction and mental illness is usually based upon myths, stereotypes, prejudice, and uneducated judgments. Obviously, in one way or another, all of our lives are affected by someone with an addiction, this being a friend, colleague, family member, or acquaintance. Substance abuse and mental illness know no bounds and can enter someone's life anywhere, anytime. What do you think of when you hear the word addict? Most words or descriptions that are commonly associated with addict are junkie, criminal, loser, and deadbeat. Did you know that these words are the language of stigma? Imagine leaving your house every day knowing that this is what people are thinking about you. With these labels or stigmas, there are many challenges that addicts face on a daily basis, such as the loss of friends, family strain, loss of employment or housing, financial struggle, and social isolation. Society also attributes negative stereotypes to people based on race, gender, sexual orientation, disability, immigration status, and obesity. These labels indicate that a person is somehow abnormal. Yet, when we think of all the layers of stigma that society has created, it makes you wonder who actually falls into the category of normal. As stated in the article, Stereotypes of Drug and Alcohol Users, on alcoholrehab.com, there are many different stereotypes that are brought to mind when thinking about people who are dependent on drugs and alcohol. The majority of these stereotypes make negative assumptions about lifestyles that include drugs and alcohol. People think those who abuse substances are typically deviants and don't engage in society like the rest of our population. They embody different values to mainstream society, skirting the edges, unemployed, and victims of bad upbringings, high school dropouts, and prostitutes. They take drugs in dark, dirty alleys, rob innocent people, go on binges, and engage in high-risk behaviors. The reality of substance abuse is that the majority of them are just like everyone else. They are parents, children, friends, workmates, sisters, and brothers. They hold down jobs, have friends, go to social functions, and enjoy their weekends. Some fail to manage their addiction and do become entrenched in a lifestyle that stereotypes embody, but many do not. An addiction does not discriminate between rich and poor, young or old. Multiple studies have been done on the stigma of addiction. One specific study caught my attention, and I found it quite alarming. According to the National Institute on Drug Abuse, a study conducted in 2012 showed that illicit drug use in America has been increasing since 2002. In 2012, approximately 23.9 million Americans aged 12 and older have used an illicit drug or abused a psychotherapeutic medication, such as a pain reliever, stimulant, or tranquilizer, within the past month. That's an estimated 9.2% of the U.S. population. With that alarming number, why is stigma of addiction still a problem? As quoted in Addiction Treatment Methods, Living with Addiction by Laura Okoloko, the stigma of addiction, the belief that people with substance use disorders should be ashamed that the addiction is a personal failing, is as prevalent as the confusion about whether the addiction is a disease, a behavioral health issue, a brain disorder, a family problem, an attachment wound, or a character flaw. With stigma of addiction, the effects are profound. Stigma can lead to prejudice and discrimination in the healthcare system and housing and employment. It includes self-stigma, which is a negative feeling about oneself. Those with an addiction issue may avoid seeking help or assistance, become secretive about mental illness symptoms, or substance abuse problems. This often leads to society This often leads to social isolation and a decreased social support system. Almost always a loss of job or career, causing significant strain on friends and family relationships. In turn, increasing poverty, depression, loss of hope of recovery and relapse. Unfortunately, often increasing the incidence of overdose and suicide. Are all addicts labeled and judged the same? Think about the media and celebrities. What do you think of when you hear their names? Britney Spears, Drew Barrymore, Nicolas Cage, Edgar Allan Poe, Oprah Winfrey, Ernest Hemingway, Robert Downey Jr., Elvis Presley. Most often you think celebrity status, they've got it all together, they're well paid, financially stable. Well, the few celebrities that I named all have struggled with mental illness and or substance abuse. These celebrities who have lived or are living with substance abuse or mental health problems have provided an immeasurable contribution to society. People can recover and continue to enrich society with their contributions, striving to be a better person and moving beyond their label. As with these celebrities, it is possible for society to look beyond the label and see a person with strengths, talents, and wisdom. There are ways our society can make a change towards stigma, even if it's just a little at a time. Offer to help someone you know get help. Stop feeding into society's negative stereotypes. Don't defend your past negative behaviors. Acknowledge them, accept them, and move on and help others in need. Reach out. Stigma is a shame. Shame causes silence, and silence hurts us all. Offer to attend a group support system or a group meeting and share your story if you have one. Hearing other stories who are where you are or have been where you are can help give others the courage they need to fight their battle. Acknowledge who others really are or take some time to figure it out. Remember, a person is so much more than their label. Use respectful language and put the person first before the illness or addiction. Become an advocate. Have an active voice within your community. Speak out and challenge stereotypes portrayed in the media, social networks, and local newspapers or blogs. If you have a chance to educate someone, please do so. Share your experience or just set them straight when they're judging someone else. We all can't walk in each other's shoes, so take some time to help someone understand the true nature of their illness. With the descriptions of stigma I've provided, it's easy to see how those suffering with addiction and mental illness might often say that their stigma is worse than their addiction itself. Quoted from Addiction, Social Stigma, and Barriers to Recovery, to a certain extent, these attitudes reflect how dependence is portrayed in the media. People with drug addictions tend to be labeled as junkies, not as people with a health problem that can be addressed. The term addict frames the issues in a particularly negative way. In closing, those living with substance abuse or mental health problems often feel ashamed, embarrassed, and fearful of being judged. These feelings come from being stigmatized by society's negative stereotypes and labels like alcoholic, addict, psycho, crackhead, and junkie. These terms often depict images of violence and criminal activity. This stigmatism leads to prejudice and discrimination, creating barriers for people who seek the help they need. People living with substance abuse or mental illness want society to know that they are so much more than their label. Even though they may wear that t-shirt that everyone sees, they are not that person. They are their undershirt, the person that everyone may not see or know about, but what truly defines who they are.